Hey, y'all, welcome back to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, private practice integrative gynecology in Austin, Texas, author of the Hormone Balance Bible, which you can get on Amazon. It's 500 pages of all the things you ever wanted to know about women's health and hormones and how those deficiencies can affect you. But what I wanted to talk about today, because we have this desire to stay on top of things. And last week, some new recommendations came out fueling the debate over mammography guidelines. The United States Preventive Services Task Force basically came out with a new statement showing kind of what they believe should be the new recommendations. And what they came up with was that the USPSTF, which is the task force, recommends biennial screening mammography for women aged 40 to 74. This is considered a B recommendation, which isn't A level, which is the highest recommendation, meaning there needs to be a little bit more data on the topic. But they basically concluded that the current evidence is insufficient to assess the balance of benefits and harms of screening mammography in women 75 years or older. The USPSTF concludes that the current evidence is insufficient to assess the balance of benefits and harms supplemental screening for breast cancer using breast ultrasound or MRI in women identified to have basically dense breast tissue. Now, basically what they're saying, the recommendations overall have been women ages 40 to 50 should get a mammogram every 2 years. Now, that changes based on your history, based on your family history, your personal history, etc. But generalized every 2 years from 40 to 50, and then after 50 was every year. This USPSTF recommendation is changing that to every 2 years from the ages of, let me tell you exactly what they said, 40 to 74. Now, we have to keep this in mind that basically, among all U.S. women, breast cancer is the second most common cancer and the second most common cause of death with cancers. In 2023, an estimated 43,170 women died of breast cancer. I mean, it's really quite fascinating to me that we have all the pink ribbons and the pink clothes and blah, 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 and all these marches, and yet we have a disease that is the second most lethal disease in women cancer-wise, and we don't have a cure for this. I mean, it really blows my mind. With all the money that's been thrown at this, it really still just blows my mind. Basically, non-Hispanic white women have the highest incidence of breast cancer. 5-year age adjustment is 136 cases per 100,000 women. And non-Hispanic Black women have the second highest rate, which is 128 cases per 100,000 women. The incidence gradually increases among women aged 40 to 49, but increased more noticeably from 2015 to 2019 with a 2% average annual increase. So they were seeing an escalation of cases between 2015 and 2019. And for all the people out there that are talking about the injections and how the vaccines did this and that, this was even before COVID, basically. So before the COVID vaccines, we were actually seeing an increase. Black women are more than likely to be diagnosed with breast cancer beyond stage 1. This is more than likely because they don't get the screening that other races get, and they are an underserved population, especially the females in that race and culture, and therefore they get diagnosed later because they don't have the same access in many cases to the healthcare to get things diagnosed. Basically, they also come out with more aggressive tumors, so that's something to consider as well. The recommendations that they made, the USPSTF, the task force, these recommendations apply to cisgendered women, meaning women, and all other people assigned female at birth. So we should just say women. Basically, it includes anybody that was born a female. I think we could have just said that. 40 years and older at average, with average risks of breast cancer, meaning if, like I said earlier, if you have increased risks, you have, a couple family members that had it, you have a lot of family colon cancer or ovarian cancer, because those things tend to have high genetic rates in BRCA1 and 2. Obviously, these are women just for average risk, these guidelines. These recommendations apply to women, who have factors associated with an increased risk of breast cancer, such as a family history, first-degree relative, or having dense breasts. They don't apply to women who have genetic markers or syndromes associated with high risk, meaning BRCA1, BRCA2, the other genetic anomalies. There's a bunch of them, check and things like that. So basically, if you're just at an average risk, these are the would apply to you. Now, basically, what they're talking about here is digital mammograms and 3D mammographies. They're saying that they're effective mammographic screening modalities, and that if you were going to do breast tomosynthesis or 3D mammograms, that you need to also have digital mammogram. But basically, what they found was that women who had repetitive exams basically probably could cut back on the number of exams they were having, because the frequency of what we were doing every year, probably after 50, was just not changing the outcomes. So basically what they did when they looked at this, they looked at the disparities in breast cancer outcomes, and then they implemented considerations. Obviously, mortality from breast cancer is higher for Black women, even when accounting for age and stage, 40% higher for Black women. Again, that population is underserved and undertreated, unfortunately, by the medical community. We know this. Basically, Black women have a higher incidence of breast cancer, and they have higher rates of death when they're diagnosed because they're at later stages. So they basically took this into account. They basically also looked at the fact that women have increased risks of breast cancer. We know that breast cancer incidence increases with age and peaks around that 70 to 74 age group. So what happens is women have an increased risk of breast cancer that increases over time until they get to 70 to 74. It seems that is the age group where the breast cancer incidence peaks. And I think that's why they're recommending that you don't need to do this biannual mammography up to 74, because at that point things have peaked and then they start to decrease again. So the potential harms, when they look at a study like this, what are the potential harms for mammography? Basically, they included false positive results, meaning the fact that you are told that there's something abnormal on a mammogram, which happens, unfortunately, frequently, and that you need to undergo additional imaging. This causes psychological issues, additional testing, and possibly invasive procedures like biopsies. There's an overdiagnosis and overtreatment of these types of lesions that maybe wouldn't happen if we didn't overscreen. So basically, the recommendation that they just came out with a couple of days ago updates their 2016 recommendation. So it's been about 8 years. In 2016, they recommended biannual screening mammograms from 50 to 74, but individualizing it. Now, keep in mind, this is the USPS task force. American College of OBGYNs, the American Cancer Society, everybody's got different recommendations. Suffice it to say, I think, you'd probably be safe if you just did a biennial mammography from 40 to 74. If you at least did every 2 years, you'd probably be, fine with that screening. I know there's a lot of fear in so many women about the radiation that's utilized in mammograms. Basically, it has been shown that a mammogram is probably equivalent to the same amount of radiation that you would get being outdoors for like 2 or 3 days. It's not a lot, but there is some, obviously, but it is fairly minimal. So let's say somebody who's 40 to 74 in this age group has had 15 mammograms. It would be, the equivalent to being in the sun, walking from your house to your car, walking around outside, things like that that would be the equivalent of about a month's worth over your 35-year span. The harms of screening, if you want to go a little bit deeper, the most common harm actually isn't the radiation, it's the false positive rate, which can lead to the psychological issues, over testing, anxiety, a lot of worry, a lot of fear, and the false positive rates, unfortunately, can be fairly high. Basically, there is an overdiagnosis. Mammography is probably the single most area in medicine that has lawsuits because the mammograms miss things. And because of that, radiologists tend to overread things because they don't want to miss something. So you have to keep that in mind. I do see lots of mammograms because I order lots of mammograms. And basically what happens is there isn't enough, people always want me to tell them what to do. And unfortunately with mammograms, I do have to practice the standard of care. And the standard of care is to order mammography at least every couple of years after the age of 40. So I do that. Now, I have a lot of women ask me about thermography. And for those of you that may not know what thermography is in and of itself is a test that uses an infrared camera to detect heat and blood flow in body tissues. Currently, the standards are saying that thermography is a good test to do in conjunction with a mammogram, but not on its own. The problem with thermography is that it is kind of touted by the alternative medicine community as being either better or as a test equivalent to mammography. And I just don't want women to have that thought process in their head because they're afraid of the radiation. Now, if you want to get a thermogram, obviously that's fine. They usually run about $300. And obviously insurance doesn't cover the cost. It's not currently FDA approved as a standalone screening tool, and there's no current scientific evidence to use it for diagnosing breast cancer. There is a study that came out that said with mammography, it did add to the effects. It added to the diagnosis. It added to I think it even lowered the false positive. So, we can definitely learn from this, but I have to practice that standard of care. So, let's see is there an alternative? I have women ask me all the time, what can I do if I don't want to do a mammogram? Like we're talking about, thermography, it's been around since the 1950s. It has been investigated by the medical community as a form of screening. However, in the 70s, there was an article that came out called Breast Cancer Detection Demonstration Project that found thermography was far less sensitive than mammogram. Now, you can do the conspiracy theory, go down the rabbit hole and say, mammography is a huge business, and you wouldn't be wrong. It is. It's probably $1 billion business, from the selling of the machines to the ordering of the tests. It's a huge business. But you have to think that if thermography was a huge business and was something, and it could be a huge business, is something that the medical community would add because it would be a moneymaker, just like mammogram. They would do it. They would add it because it's something they could bill for. I don't think the conspiracy theory that the money is the issue really holds a lot of weight, because if your theory is that medical community just wants to make money off of people, then why wouldn't they want to add mammogram or thermograms? Because they'd make about $300 a pop. So And actually what's fascinating is there would be a ton of women that would get them done because I think women are wanting another option, and it's cash based because insurance doesn't cover it. So it would be a win-win for the medical community. So thermography is not considered an alternative to mammography currently. It has the high false positive rate, which means that sometimes it finds cancerous areas on the thermogram that aren't actually cancerous areas. And in women who have been diagnosed with cancer, the test is ineffective at corroborating the results. So basically what they found in a 1990 study, now keep in mind, that's 34 years ago, but in that one study, that were more than 10,000 women that were looked at, 72% of the women who developed breast cancer had a normal thermogram. Now, that's not to say that it missed the cancer, but I think what their point is that it didn't necessarily change the outcome. Mammography itself also has false positives, as we're aware. However, it's not to the same level as a thermogram. It's not more effective at screening in women under 50 or those in women that have dense breasts. How do I counsel my patients? I tell women, if you want to get the thermography, that's your choice. I mean, the beautiful thing is, it's your choice. It's not a very invasive test. It's a camera, takes a picture. They usually get about 6 images from the front and sides of your breast. It takes about 30 minutes. Like I said, it costs about $300 depending on where you live. And although it's safe, it's not necessarily effective. So, how do you look at this? Well, yeah, it's safer. There's no radiation. But if it doesn't have the data yet, then why use it? And if it has a higher false positive rate, then you're going to be getting mammogram, blah, blah, blah. Anyway, so, it's one of those things. They say in this article that the thermography average cost is about $175 to $250. I don't think that it's actually that low. I think it's probably a little higher. Questions you should ask. When you go in for your mammogram or when you go to your annual exam, what are some things that you could ask? Well, I would ask, are you at high risk? We should be asking you once a year your family history, your risks, things like that. You should ask your doctor if you should get a mammogram. You should ask them when you should start getting mammograms. How often do you need to get the mammogram? What are the possible risks of the test? What happens if I have a false positive? What's going to happen, if I test positive? Do I need thermography or other additional tests to screen for breast cancer? And then what are the benefits to you? I think those are all fair questions. And I think any doctor that's ordering something should give you a reason for the test that they're ordering. That just makes sense to me. So you should have the things that you need to get the test done, and you should have the ability to ask questions and get answers for those things. So what I would say is, currently, if you came in to see me, I do order mammography. It's just part of my practice, and I will order that every couple years. I obviously am not going to drive you to your appointment. I would say that it's America and we all have choices to make, and we, pick and choose what we want to do in our lives. And if you don't feel mammogram is something you want to do, you obviously don't have to do it. But I feel like it's in my best practices as a physician to at least recommend it and order it. I don't withhold medications. I think doctors that do that are a little bit ridiculous because it's kind of, in a way, you're strong arming a patient to do something you want them to do. And I just don't think that's something that needs to be done. People should make their own educated choices, and they should feel good with the choices they made. And as doctors, we can certainly document that we talked about it, that we recommended it, that you didn't want to do it. And that's, that's the beauty of where we live and what we do. And you shouldn't feel guilty about making decisions that you feel are right for you. So let's suffice it to say the current mammogram recommendations are every 2 years from the ages of 40 to 74. you probably don't need to go every year once you hit 50, unless, of course, you're in a higher risk group. So the interpretation of this every 2 years is based on the fact that you have an average risk profile, that you don't have increased family histories, that you haven't had, obviously, breast cancer yourself, that you don't have a lump that's abnormal, that you feel like, you know, you've had that worked up appropriately. It's for women with an average risk profile. If you have any other high risk issues, you obviously want to get those checked out, and we want to maybe get an ultrasound, biopsy, whatever needs to be done. We might screen women differently. I have a patient, say, who had a sister who passed away from breast cancer at the age of 35, and she also tests positive for BRCA, so she gets MRIs every year. So there's a different screening tool that women can do. And the great thing about an MRI is there's no radiation involved, and it's a very good test. However, very expensive, and it's not going to be covered by insurance. Unfortunately, it can run probably, you know, $800 or $900. So definitely, you know, if you're wanting to use your insurance, obviously mammogram would be best. Keep in mind that there is a false positive rate. I always try to calm people down when they have a positive, because obviously we see this all the time, and most of those are actually negative. So mammograms every 2 years from 40 to 74. I'm going to keep this a little short because I've heard people say that the shorter episodes actually are easier to listen to and easier to digest, because sometimes I throw a lot of information at you. This is Shawn Tassone, author of the Hormone Balance Bible, and obviously your host on Confessions of a Male Gynecologist. Would love a 5-star review if you can feel it in you to give me one. I do see patients from around the country. I'm currently licensed in 26 states, just added California. If you feel like your hormones aren't where you want them to be, if you're feeling off, insomnia, weight gain, irritability, decreased libido, decreased energy, fatigue, and everybody's telling you you're fine or they won't draw labs, please feel free to give me a call, 512-956-0296. If you go to my Instagram page at Shawn Tassone MD, you can find on my second pinned post that I have all the states listed where I'm licensed. You can also go to my YouTube page and actually see my beautiful mug if you'd rather have this as a video. Those are posted there as well. Have a great day. Have a great weekend. Talk to you later.